But I do want to welcome now Dr. Kamal Nagpal, who has just joined us. And he has a very, very unique profile. He's a urologist, one of the very hard specialties to match into from Tufts University. He has home country residency. He did his stint in UK. He had a PhD from Imperial College. So very, very accomplished, very bright physician. So welcome, Dr. Nagpal. And what we wanted to get the perspective was many of you have questions, UK versus US, how do I choose? What do I choose? So he will be the right person to talk about home country versus UK versus US. So welcome, Dr. Nagpal.
Thank you, Pawan. Very excited to be here, and thank you everybody for having me. So I will just talk briefly about it, and then it will be good if people ask questions because that's a better way to know about it.
Yep.
So as Pawan mentioned, I left India in 2003, then went to UK to do urology, but then actually moved to US in 2009. So after seeing the system in UK and US, there are a few things which people should know before they embark their journey from India. So UK has a unique system in the sense that, you have to, I'm sure, Pawan, you might mention, you have to do PLAB and some exams to get into the UK, and then you have to residency. So anywhere, even in UK or US, both places, surgical branches are tough to get in. That's just a fact. So that somebody should be prepared of. Medical branches are a little bit easier. And super specialty branches as urology, they're really, really hard to get in. And in UK, so the system, I was there in 2000, from 2005 to 2009. So things may have changed. I'm not updated with that. But at that time, they had this system that if you have a graduate from other country, you have to do this lab, and then you have to get to the, if you want to do surgery, there's a basic surgical training program. It's called BST, where, again, that's a little bit harder to get in because in UK, they have training posts. So training posts are a little bit harder to get in. But if you have done some research and if you show keen interest, you do some observership, it's not impossible. Nothing is impossible to get anywhere. And then you do that BST if you want to do surgical branch, which is sort of a 2.5 to 3 years training where you rotate to different specialties, vascular surgery, orthopedics, colorectal. And then whatever you want to decide, then again, there's a bottleneck after that, another competitive process where you have to get in if you want to do surgery. So if you want to do urology or general surgery, then that's another 5 to 6 year program after your basic surgical training. And during that, you do certain exams as well. And then that's basically 5 years or 6 years training, and then you become a consultant urologist. And in UK, in terms of a little bit of financial things, UK, your financial reimbursements are not that great compared to US. So your salary as a resident is not bad, it's pretty good. But as attending, it doesn't take a huge jump. So that's one thing to consider. I will tell you briefly about US. So US is, you have to do USMLEs, and then after USMLE, you apply. So urology is a little bit tough. So some people try to do general surgery first for a couple of years, then move to urology. But there's a direct urology programs also, which is 5 to 6 years, depending on where you do. So there's a lot of urology programs. And in US, if you do some research before or some observership before, again, it gives you advantage. And after this 5 or 6 years program, you become attending. Then you can do some fellowships if you want to do, like I did robotic surgery fellowship, whatever. There are a lot of fellowships you can choose after that. And then again, in financial terms, US is much, much better than UK long term. And the opportunities are a little bit more in US than UK. So that's pretty much in the nutshell.
Thank you. So the first question is, if someone is in the UK, what should they be doing? What type of experiences should they be getting to become valuable in their USMLE journey so that programs look at them favorably?
Sure, yeah. That's a great question. So if you're in UK, you basically do some research. You do the rotation in that field if you want to do. If you want to do surgery or urology or any other specialty, you should be spending a lot of time in that one. So research, doing rotations, getting a good letter of reference is very good actually, because if you may not have US reference, so they will look at your UK reference. So that has to be exceptional. And then also publications, presentations, that counts a lot. So I would say experience in that field with some research, publication, presentation, and a good LOR. That will be helpful.
Then the next question is about difficult specialties. So whether it's urology, general surgery, dermatology, is research in the US required to get in these specialties?
Yeah, that's another good question. So it's not mandatory that you have to do research, but if you do it, your chances of getting the specialty is easier. So until you have something exceptional on your CV, except research, you are a very bright student, or you have something exceptional that, whoever's looking at, they say, wow, that's a great applicant. If you don't have that, then research is good, because research will help you to give you presentations and publications as well. So indirectly, it will really help. So I would say if you are getting to difficult specialties, it's a good idea to spend maybe a year of research in US before you apply.
And categorical programs are much harder to get in for these competitive specialties. So should we just target the 1 year prelim programs before we move to advanced, or do you think categorical is also something we can aspire to?
You definitely, there's no harm in applying. Depends on how your baseline application is. You may or may not get it, but you should not be disheartened, because, it's just a competitive process. So you should not get disheartened, that you don't get in, because it's very common for people not to get in. People leave country, they don't apply because they don't. So just expect that, but there's no harm in applying. You may get lucky. Sometimes programs are looking for, they may not have the great applicants. And if you're one of the good ones, you may get an interview and then you can shine there. So there's no harm in applying. But obviously if you can't get in, then you should have a backup. So you should definitely apply prelim programs as well, where you can show them in 1 or 2 years that you're a great candidate, and then your chance of converting to categorical becomes easier. So I would say apply both of them, and apply a little bit more on prelim side as well. So you definitely can get in. You have 100% chance of for sure, and other one you kind of take a gamble.
How did you keep up your motivation? Or I guess they are asking, how should we keep up our motivation given the surgical residencies are so hard and they take time? You have done undergrad, and then probably most of them have done home country residencies, then another 6 to 7 years here. So how do you keep up the motivation? And of course your personal issues also come up. So what are your tips for that?
Yeah. So I would say if you really want to come here, first of all, you have to decide whether you want to come to US or not. So everybody's circumstances are different, their personal, their financial, their family, and their professional circumstances. So first of all, you have to decide whether you want to come here or not. If you decide, then, it's not, US actually is a land of opportunities. If you may have heard about it, and that's true. I'm saying that as well. It's very true. It is a land of opportunities, and nothing is impossible. So you definitely, first of all, you have to think that nothing is impossible for me, because I'm sure you have seen people like me, or the other people who have gotten into surgical fields. So this just may have shown you that, we guys as Indians, we can definitely get it. So that's the first thing, that you should believe in that definitely you will get it. And then you have to work on it. You just have to be persistent and determined for anything else. Anything else you want to achieve in your life, you have to have that persistence and perseverance, because you will get it. It's just a matter of time. You may fail one time, you may fail other time. Don't get disheartened. You just identify why you fail. And, if some programs reject you, you can definitely email their dean or their program director or whoever is making the decisions to see, what can you advise me? What is lacking in my application so I can work on that? And people, sometimes they're very open. They will tell you, you should work on this. You may do one year research, or you may have something more on your CV. So I would say just be very determined, very persistent, and don't be disheartened at all. It's a little bit tough process, but long term, it's really good. Once you get in. And once you get in, the 5 or 6 years program will just go by. You will not even realize. The surgical specialties are so busy that you will not even realize. And then you make great relationship. And it's a great residency program. So, you will enjoy it. You will learn what you want to learn. You will enjoy it, and you make great friends. So that part, you should not worry about it, that how will you spend 5 to 6 years, and then you get your residency salary as well. So it's not that you financially have not, and that's pretty good if you're single and with family also. It's not bad if you kind of do a little bit of lead thinking. Okay. So I would say, yes, just have that motivation that is you want to do it and you have to do it, and it's not difficult if you really want to do it. So it's a mountain, you have to climb, and there will be a little bit of failures, but as with anything else, it's just in life, everybody have that. So you should be determined for that.
Next question: are UK LORs recognized by program directors here?
That's a good question. So if you have not have any US experience, and if you have not done any US observership, then yes, definitely it's better than. So obviously US LOR is better than UK LOR is better than Indian LOR. So that's what I would say. If you did some observership in US, then obviously you can get LOR from here. That's great. But if you didn't get any chance and you're just in UK and you don't have any chance to come to US, you don't have to specially come for the observership just to get that LOR. It doesn't carry that much vision that you will spend your 2 months just to get LOR. But UK LOR is not as strong as somebody who has US LOR, but it's definitely it counts. Because people look at that a lot, so yeah, it counts.
Will all UK degrees, MRCP or MRCS, help me get a better match?
Absolutely, yes. So my wife, actually, she is also an anesthesiologist and pain physician here. We were in UK as well, so she did her FRCA there, and FRCA is very difficult exam. I don't know about MRCP. MRCP is pretty good, but difficult as well. So her program director told her that, FRCA is one of the things we look for. And that was one of the main highlights for her to get into that program. So yes, they recognize it, and they know that person has studied for that. So it shows, absolutely. That's one of the jewel in your crown if you want to apply.
Maybe the last question, which I think will summarize your journey. What did you do to stand out to the urology programs in the US? It's one of the toughest. So if you can just summarize your journey, and, so who's an ideal urology applicant?
So mine is a bit unique, and again, everybody doesn't have to be like that. So I did my surgery actually before I left India. So I did my master of surgery, and during my master of surgery, I published as well, and my research. So that helped. And then in UK, I did my PhD from Imperial College. So that really, I think, helped, because in that year, PhD, I published a lot. So I had like 60, 70 publications before I applied urology, and I had a lot of presentations. At that time, I really used to present a lot. I loved it. So I had a lot of presentations, maybe 100 presentations. I had 50, 60 publications. I had PhD from Imperial College, London, and my MS experience in India. So I think that all added up, and I got LOS as well from UK. So that all added up to get me urology, I think. But again, saying that, I don't want somebody to feel disheartened that they don't have that much publication presentations. So you don't need to, but the more you get, better it is. And, so that was my situation.
Well, thank you, Dr. Nagpal. Much appreciate your time, knowing how busy you are. I think this is very, very helpful for applicants who are trying some of these surgical specialties. So thank you again for your time.